Hello and welcome to the 3FOUR50 News. I'm Amanda Cowley. This month, the UK's National Institute for Health and Clinical Excellence produced guidelines for the prevention of cardiovascular disease at population level. The 12 recommendations of the report lay out a national framework to improve heart health, focusing on legislative, regulatory and voluntary changes, and including the further development of existing policies. The recommendations are extremely broad, covering nutritional issues such as trans fats, and also tackling design of the environment through health impact assessments and active travel. Somewhat controversially, it suggests that local authorities should be empowered to influence and restrict planning permission for food retail outlets near schools, for example. The World Heart Federation held this year's World Congress of Cardiology scientific sessions in Beijing, China, on the 16th to 19th of June. Many topics were covered, with a particular focus on women's heart health, cardiovascular disease in China, and rheumatic heart disease. The results from the Interstroke study were presented, in which the role of lifestyle and chronic disease was very clear. The study identified 10 risk factors that together are responsible for 90% of all stroke risk. Indeed, just 5 of the 10 risk factors accounted for more than 80% of the risk of stroke. These were hypertension, current smoking, abdominal obesity, diet and physical activity. The study also suggested that quitting smoking rapidly reduced the risk of stroke, implying that smoking cessation is essential to stroke prevention. Smoking cessation was also highlighted in relation to heart health, with a call for cardiologists to take action to work with patients and policymakers to promote understanding of the negative impact of tobacco on the heart. A global coalition of nursing organisations met in Washington on the 24th to the 25th of June to launch a movement to engage the nursing workforce across the world in the fight against chronic disease. Organised by C3 and the International Council of Nurses, nurse leaders from Malta, Panama, Slovenia, South Africa, the United Kingdom and the United States were joined by internationally renowned experts in the field of chronic disease. By the end of the meeting, the country representatives had begun the process of action planning to ensure that nurses in their countries are equipped and enabled to take a lead role in the fight against chronic disease. The country action plans will be monitored and supported throughout the coming year. The ICN conference in Malta in May 2011 will provide a focus for countries to share their progress and to expand participation to many other countries. If, like C3, you have a conference or seminar which you'd like to see highlighted in the video news, feel free to contact us. That's it for this week, and if you've got a story you'd like to share, please email us at info@3four50.com. Thanks for watching and join us next month for 3FOUR50 News.